morning. During the COVID-19 pandemic, telemedicine has experienced a rapid escalation in use. It has been used to reduce disease exposure and the strain on patient demand in healthcare facilities, but there are certain limitations to its technology. My name is Rhea McKim. My colleagues are Om Mistry, Samita Sampath, and Pranshu Shah, and we are working to challenge yesterday's barriers with effective responses in telemedicine. According to the CDC, 95% of health centers reported using telemedicine during the pandemic, from only 43% in 2019. There have been changes within telehealth itself as a result of the pandemic. For example, Medicare will now pay physicians the same rate for virtual services as in-person services, and physicians can waive or reduce cost sharing for telemedicine visits. When discussing complications such as sudden cardiac arrest and atrial fibrillation, telemedicine and remote patient monitoring are crucial. Patients that are at risk for sudden cardiac arrest due to identified cardiac irregularities or other conditions can use a remote monitor that continuously records heart activity and transfers this data to their electronic health record. One specific monitoring method is mobile cardiac telemetry, which uses a small portable device to record cardiac activity. This device records arrhythmias that may have been felt by the patient, but the patient is also able to manually enter symptoms. This is just one type of technology that digital health offers. It can also be used to promote patient education relating to cardiovascular disorders and assist rural hospitals with efficient management of cardiac arrest and resuscitation efforts, because in counties with populations of less than 20,000 people, about 60 to 90% of hospitals do not have a board-certified emergency physician. Furthermore, different specialties can benefit from the wide variety of technology that telemedicine offers. Small hospitals may not have a radiologist, and patients coming to the emergency room can remotely send x-rays to a radiologist at a different location. For dermatology, a patient can send a picture of a skin anomaly to a dermatologist for a remote diagnosis. Furthermore, cardiac telemedicine can be applied to obstetrics when patients have to travel long distances for care and take time off of work or other responsibilities. They can be given instructions and supplies for monitoring blood pressure and fetal heart rate. The use of digital health and cardiology, along with other specialties, has the potential to solve rural health disparities. Om will now discuss the breakdown to telemedicine.
Thank you, Rhea. Talking about the breakdown, I would first like to talk about the concerns surrounding the examination process. Although doctors weren't able to carry out the process of examination process of auscultation, percussion, and palpation during the pandemic, they can still carry out an in-person visit for the patients who need critical care. Other things surrounding an in-person visit, such as the scheduling, payments, coordinating, all while being able to provide the information on the prescription and follow-up visits, can be all done through the help of telehealth services. This way, we can decrease the amount of exposure time inside the clinic for a patient. Talking about telerehabilitation. Telerehabilitation not only reduces the cost for both the health officials and the patients, but also increases the patient reach, especially those living in the rural areas, where inpatient rehab is not that accessible. They can use the advantage of this technology. According to a research conducted by International Journal of Telerehabilitation, patients in the virtual condition attended 2.77 more sessions than the patients in the in-person condition. Now, going over the clinical burnout aspect of telemedicine. According to a study conducted by AMA, 43% of the physicians suffered from work overload and 49% had burnout. Lastly, talking about the privacy and security issues, health agencies have been targeted by ransomware attacks, including the Champaign-Urbana Public Health District in Illinois, which served around 200,000 people. While officials were trying to bring it back up, it significantly limited the doctors to communicate with the public. Now, Samita will talk about the effectiveness and perception of telemedicine.
Thank you, Om. Telemedicine has many benefits and is effective. Primarily, it provides for comfort and convenience. With telemedicine, patients do not have to drive to the doctor's office, and they can see the doctor from the comfort of their own home. It is easier to fit virtual visits in a busy schedule, and it eliminates childcare and taking time off of work to go visit the doctor. Secondly, it provides for control for infectious diseases. Doctors can pre-screen patients for possible infections, reducing the amount of exposure. According to the CDC, there was a 154% increase in the amount of telemedicine visits in the last week of March of 2020 compared to that same week in 2019. We also did a survey asking if the public was more or less likely to use telehealth after the pandemic. We found that 79.3% were more likely to use telemedicine compared to a low of 20.7%. Furthermore, telemedicine is cost-effective. Providers of telemedicine services may incur fewer overhead costs, such as paying less for front desk support. Also, the at-home triage service facilitated by nurses and primary care physicians reduces the unnecessary and expensive use of the ER. Remote analysis and data monitoring technology also reduces the healthcare service costs by reducing the unnecessary and expensive use of the ER. Telemedicine can also increase revenue by attracting new patients and even reducing the overhead costs for doctors. In short, doctors can see more patients in the same amount of time. According to the Medical Journal of Emergency Medicine, there was a net savings cost of $19 to $121 per telemedicine visit. Finally, telemedicine increases patient engagement. This makes it easier for patients to reach out with follow-up questions to their doctor and report early warning signs to them. We did a survey asking how comfortable SCARF students were with attending telemedicine visits. The overall mean was 7.9. This demonstrated that SCARF students are more inclined towards telemedicine. The effectiveness of telemedicine increases when patients are open to this type of treatment. Digital technology makes it easier for patients to schedule times with their doctors, allowing them to feel more connected and engaged. This survey was taken with the SCARF demographic. Now Paranchu will further talk about telemedicine in rural areas and globally.
These benefits that Samida mentioned can only come to fruition if we are able to access our patients. Yet, according to the UN, 40% of the world still lacks access to internet. And of that 40%, 85% reside in rural areas. When the United Nations further examined this data, a disparity was uncovered: gender. In rural areas, only 12% of internet users are women. 12%. This is extremely concerning when a CDC study is taken into account that found that women in rural areas today are 11.2% more likely to die from coronary artery disease than 20 years ago. The bottom line is that mortality is increasing, yet access to care is not, and people are losing their lives as a result. That is why our initiative seeks to employ both digital and physical platforms to empower these women to become their own healthcare advocate. We have included the line for the domestic abuse hotline because we're not sure exactly what is hindering them at home, as well as our physical and online addresses to help them begin this online journey. Beyond accessibility and gender disparities, telemedicine does have countless benefits through things like developing technologies. One such being an ambulatory blood pressure cuff. As pictured here, a patient is able to take this blood pressure cuff home, put it around their arm, and the cuff automatically measures their blood pressure and uploads it to the cloud. This allows physicians to not only see a few data points, but trend lines when it comes to blood pressure, and thus better predict where it is heading and prevent cardiac complications from occurring well before they become too severe too. Medicare has recently approved covering these blood pressure cuffs for all geriatric patients over the age of 65, showing that the standard of care is moving towards these technologies. A common complement to these blood pressure cuffs are Bluetooth stethoscopes. Yet unfortunately, on today's market, they're extremely expensive and therefore inaccessible for these rural areas. And so, with the help of 3D printing, we were able to design our very own Bluetooth stethoscope, which reduced the cost tenfold. We hope to be able to further provide access in rural areas and effectuate preventative care among our physicians. Innovations like these are on the forefront of medicine, and as the scope of healthcare is rapidly changing, it is our goal to ensure that nobody is left behind. And so as we move forward, we ask you to join us through this cyber shift in medicine. Thank you.